This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. We are going to have a very interesting episode and I'm thrilled about today's guest. He is working as an assistant professor at the Department of Global Public Health Sciences at Karolinska Institute in Sweden. He leads research focusing on links between physical activity and inactivity and mental health. He is an associate editor of Scientific Journal of Mental Health and Physical Activity. Ladies and gentlemen, please welcome our guest, Dr. Mats Hallgren. Welcome, Mats, and thanks for taking time for this podcast.
Hi, Olli. Thank you very much for having me. It's a pleasure to be here.
So, Mats, what kind of research you are doing at the moment?
So, as you mentioned in your introduction, my research focuses broadly on links between physical activity, inactivity, namely sedentary behaviour, and associations with mental health. And I'm involved in both observational studies, so using register-based data from Sweden, and also experimental studies looking at the effects of interventions, exercise interventions on mental health.
At the moment in the world, there is a coronavirus pandemic and there are drastic measures to limit the pandemic. How do you see that this will affect the mental health?
Well, that's the million-dollar question. And I think we're going to see a rapid increase in research on this. And that research hasn't come out yet. So, But speaking as a layman and a psychologist from the start, I think clearly this is having detrimental effects on people's mental health on different levels. Obviously, some people have lost their jobs. People, for example, working in hospitality, people working in healthcare who are highly stressed. And look what's happened in Italy with many physicians contracting COVID and actually dying. I mean, it's tragic. So, and then of course you have people who are self-isolating, which is recommended at the moment, myself included. And that has potential detrimental effects on mental health because we are being taken away from usual social contexts from colleagues at work and perhaps spending less time with family and friends, which is rewarding to us. And provides support and reduces the likelihood that we'll feel sad and anxious. So I think on multiple levels, this incident that's going on is going to affect people's mental health. Yeah.
And how do you see especially the elderly people? They are over 70 years old, have been considered as a risk group, and they should be really limit social contacts. Do you see that there will be a loneliness epidemic among elderly people?
Yeah, well, this is a good point. So what we know is that we see a couple of peaks in depression, and one of them across the lifespan, and one of those peaks actually is amongst people who are elderly, especially those, say, around 75 plus. It depends on the individual study you're looking at. And that can be linked to health problems, but also to isolation and feeling disconnected and alone. You know, when people's usual contacts start to disappear because people have died or moved away, maybe their family has their own family now, etc. That can bring about sadness and loneliness. And now those situations are exacerbated further for many people. So I think definitely amongst amongst the elderly, we have a high risk group there that we should be thinking about carefully what we can do to minimise the impacts of the COVID situation on their mental health and their physical health.
Mm. And how do you see that elderly people are, I think, quite often also quite sedentary? And how do you see now that their movement is limited even more? How do you see that will affect also the mental health?
Yeah, so physical activity tends to decline with age on average. And the elderly, let's for argument's sake call the elderly 65 plus. It's a bit arbitrary, but so we know that they're a group who are quite physically inactive on average. Of course, there are people who are 80 who are highly active. I think it's only likely to increase their inactivity levels further if people feel more housebound and are invited out less and are being told by public health agencies and on the news and so on to stay indoors as much as possible. I mean, that's really the message at the moment, isn't it? Stay inside, avoid contact with other people. So it's a clear message, and it will keep people inside more and very likely reduce their physical activity levels. So what's that going to do to people's mental health? Well, study after study has shown links between average levels of physical activity and mental health. So the less active people are, the poorer their mental health tends to be, even when you control for other factors that can affect mental health. It's a quite strong predictor. So I think the physical activity combined with or compounded by the social isolation will have detrimental effects on people's mental health. And I think we need to quickly get messages out there. Health organizations locally and nationally need to get messages out there, practical messages on how people can change their daily life structure or routines to minimize those impacts. How might that look? Well, that's the question. So I think having a routine, speaking to people on the phone through Skype, using social media to remain connected with people, and having as much as possible strict movement routines is very important. So a simple message there is just sit less, move more often, have regular breaks from extended sitting. As we talked about previously, especially extended sedentary behaviours that are mentally passive and so on. I think that if we can get those messages across to people, they might be helpful.
Yeah, and how would you do that? For example, I think in the UK now the government rule is that you are allowed to go outside once per day for the exercises, and you are not allowed to go more than once for that, and then you might have a small apartment. How would you do the activity in this very, very different and difficult situation?
Yeah, okay. So, yeah, I think at the moment in different parts of the EU, if we're talking about the EU, the rules or the guidelines are a bit different in different countries. But so if you're only able to go out, or if it's only recommended that you go out once a day, then one way to make the most of that time would be to have a brisk, moderate walk of 30 minutes or more, for example. So then you would be getting some of the recommended moderate to vigorous physical activity that we want people to do each day, or at least every other day, to reduce the risk of poor somatic health. But there's a lot of things that people can do at home as well. We know, for example, that yoga-based exercise has hormonal effects and has positive effects on mood and anxiety. And that's something that can be done relatively easily at home. So that's one option. people could also do things like skipping, stretching, body weight exercises. There's no end to the variety of exercises people can do with their own bodies. And there's lots of good videos on the internet as well to guide some of this. So I think people need to be a little bit resourceful at the moment, think a little bit laterally about how to move more and sit less for these long days if they're at home. But it is definitely possible.
Yeah, and I think many times quite many people don't have the motivation even, or they don't get to do it even when there's exercise facilities open and you can go freely outside in nature. Do you think that the being isolated at home would cause anxiety, and then people would actually start looking for ways to relieve this anxiety through maybe physical activity?
Yes, I think so. I think the whole scenario is making people anxious, not just because they're homebound, but because people are worried about contracting the virus and getting sick, of course. So I think in different ways, anxiety levels are rising. And this is purely from my own observation, but I can sense that with people when I'm out. I don't know if you've had this experience yourself, but people seem a little bit more on edge. So I think if we start measuring that, we would see that anxiety levels have likely risen since this began, not surprisingly. And people will probably deal with that in different ways. Unfortunately, some people will deal with it by perhaps taking drugs, drinking alcohol, things like that. There'll be some people that find that that's a solution. But what we want, of course, are healthy ways positive ways to deal with anxiety that occurs in situations like this. And exercise is a great way to reduce anxiety acutely. I do think that, people also need to put the situation in some perspective and remind themselves that there are ways to keep active even if you are largely homebound, and that the situation will likely pass with time. I say that as a complete layperson, but that's my hope and that's my expectation. So I think with some self-discipline and routine and structure, it is possible to remain quite active and reduce sedentary behaviour even when you're homebound. But it does require a bit more initiative and a bit of lateral thinking in terms of what activity you do. One thing that can be very useful is telling other people, telling a friend, a relative that you want to be more active during the day, and trying to get some support or encouragement from someone that's near you. We know from other studies of exercise that can be a great way to increase physical activities when you have social support. And indeed, I was involved in a study a few years ago where we found that levels of social support at the start of a treatment study for depression predicted the reduction in depression severity over time. So social support is good for exercise adherence, and it's good for our mental health. So that's a potential strategy to increase exercise during this time.
And it also is difficult because I think for many people the social part of the exercise session in a gym or somewhere has probably been important motivator to keep doing, and now we are asked to socially isolate. So how would you do this social part in this situation?
There's probably a few different alternatives. One thing that you could do is you could use the internet and look for videos where even though you're not part of a group that's training, you're watching a group that's training. So that might be one strategy. Another strategy might be to to call someone and tell them that you're going to exercise and agree to exercise at the same time, even if you're located in different places. This could work. I think it's tricky. That's the bottom line. I know what you mean. People are used to training at gyms, having a very different routine, which is rewarding. You know, behaviors tend to be perpetuated by environmental consequences. And if you go to a gym normally and you're rewarded by that environment, including the social aspect of that environment, and that's suddenly taken away, then there's potentially less rewards associated with exercise. But still, I think, of course, it's possible. And I think if we bear in mind that this is likely a temporary situation, hopefully people will find a way to continue their routines anyway with some adaptation until it's past.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behaviour change in sedentary behaviour and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
And how do you see the anxiety probably from this situation? We really don't know how long this will last. That I think in UK the restriction for the risk groups was that you need to stay home for 3 months, and it's already quite a long time. And now I saw to Finland the prediction that it would take about 5 to 6 months to get kind of that the peak is after 2.5 months, and then going down you are in the same level of infections in about 5 to 6 months. So this is going to be quite long, but people don't know. How do you think they will feel and how to cope with the situation?
You know, Ollie, I'm only guessing. I don't know, but certainly I think people will feel and are feeling more anxious. That's really obvious. So I think connecting as much as possible with friends, through telephone, through social media, plays a role. I know that my local gym, for example, is now just starting to offer online classes, which are live, so you can actually log into to some exercise classes online. At my work, we're also doing some live meetings, so we have a semi-regular contact with each other through that context. So maybe some of those online electronic mediums will help reduce people's anxiety somewhat. But it's difficult. I mean, it's an uncertainty, isn't it? And 3 to 5 months is a long time. I think what remains to be seen yet is whether or not we'll be told to stay at home for that time, or if we'll gradually go back to work and have increasing work hours again over the next 3 to 5 months. I don't know how that's going to look.
We definitely don't know. Do you have any idea? Like, there's probably some kind of slope or curve that people kind of are now getting used to the new situation. They probably get kind of used. Then there's some kind of getting annoyed again, or some kind of reactions. And do you think there's some examples that we could take from, for example, if there's a traumatic experience, how does the slope go in there, or something like? Can we have some guesstimate how it will go?
Yeah, that's a smart analogy. If you think about grief, I don't know if grief is really the right analogy here, but it's some kind of it's a marked negative change that has occurred quite suddenly, isn't it? So maybe there's some parallels between this and a sort of grief reaction. So people go through a period of adjustments, of feeling awful for a period of time, and then slowly lift out of it. So with some luck, we'll see a similar trend where there might be an initial increase in anxiety, people feeling sad, more cases of clinical depression and so on. But then slowly over time, people find a way to live with it, at least temporarily, and that we see a return to what we might call baseline levels. So I have colleagues in the UK at the moment. Lee Smith is one of them who I think are starting to study this, or trying to get studies going where they can monitor some of these changes over time. So it'll be interesting to see data come out from those sorts of studies.
Yeah. Have you yourself thought any studies? I think it could be very interesting. People have now different amounts of sedentary behavior, and probably it is causing anxiety and different kind of signs of depression, for example. Have you planned any data collection?
Well, yeah, it's a good question. So just now, actually, I've had some brief discussions with my colleagues in the UK, Lee Smith, Brendan Stubbs, and some others, and I've had a look at their questionnaire, what they're proposing to do, and we're trying to find a way to implement something similar here. So we're thinking about an online survey where we ask people about their mental health, and also, among other things, their physical activity levels, their exercise habits, and their sedentary behavior habits, and so on, and seeing how those change during and then later on after the COVID-19 pandemic. So we'll see how that goes. But the goal there is to try to get surveys running in parallel in several different EU member states, and to ask the right questions during and then after the episodes, or perhaps a couple of times, and see the trend, how mental health has changed, and what factors are linked to the changes in mental health as a consequence of this situation. So that's going on at the moment. Yeah.
Yeah, I think it's a good opportunity, if you can say that, to collect some special data at the moment. And how do you see, like, there's millions of children now out of schools and learning at home with much less contact with friends and with much less hobbies. How do you see this affecting children?
Yeah, so I think we might see similar sorts of impacts with kids. I think when children go to school, of course, they have structure, they have routine. Sport and exercise is a big part of most school curriculums. So we would very likely see changes in their activity patterns as well. And again, it's a question mark as to what effects that will be having on their mental health. I think it's not easy, is it? I mean, if you're a parent and your children are at home, it means that you're forced to stop working as well. So that has financial consequences. It means more stress potentially at home. And children want to be out doing things. Most kids want to be social. So if there's restrictions on those behaviors, then I think it will make them feel bad. So it's important to monitor that as well, and to try to think of innovative ways that we can keep kids sane and happy during this period. Yeah.
Yeah, and how do you think it will affect their learning if they are more sedentary? Probably they will be more sedentary because the parents are looking after them, and there's no kind of the breaks outside as regularly as in the school, and there's quite a strong relationship between learning and physical activity. How do you see the effect on learning?
Yeah, so I think the whole scenario would be affecting kids' learning. I think it's not just about being more inactive. I think it's the perceived stress and worry and anxiety that's linked to what's happening that would affect their concentration and learning potentially. But just thinking about the movement aspect, so we know that even short bouts of exercise, which can affect blood flow and concentration and learning. There's lots of studies which have examined those links. And people who exercise regularly, there tends to be an association with better some measures of work performance. And I think there was a study also showing links with some intelligence tests. So the connection between movement and learning is quite strong. So to answer your question, I think if kids are at home and they're less active and they're more sedentary, it would mean potentially that that their learning is slowed or delayed, at least temporarily, during this time. I don't know what effects that will have long term, but that's how I see it at the moment. Yeah.
Yes, and you mentioned about the stress and anxiety of this situation in children. How do you see the role of parents? How should they be telling about this situation to kids and how they could relieve this stress and anxiety?
Yeah. This is probably starting to stretch a little beyond my expertise. So I'm speaking now more as a layperson, if that's okay. Yeah. But I think honesty is a good strategy from the start. Be clear about what's happening in the world, and not to exaggerate the situation either. So to be honest about the potential risks, but not to exaggerate it either, so that we create unnecessary paranoia in children. I think that's important. I think also kids respond pretty well to structure and routine. So trying to create some sort of routine that they can follow, even if they're away from school, I think is very important. And that should involve structured learning and regular breaks from learning during the day and some physical activity. So trying to emulate or mimic to some extent what they might do at school. That's very hard, of course, but I think that might help to reduce their anxiety and stress.
Yeah.
This podcast is sponsored by Fibion.
My name is Dr. Paul Batman, and I'd like to just say a few words about Fibion. I've used it a number of times on different projects that I've been involved in, and find that it's incredibly reliable, very valid, and incredibly sturdy. I love the graphics that come with it. It really is very clear and could easily see the active and inactive periods as well. So I'd certainly recommend Fibion to anyone that's interested in finding out more about sedentary behaviour, particularly the concept of sitting and how we can possibly break it up with some really good, valid information.
And what do you think after this is over? What do you think that are the good things that we learned from this, or what are the positive sides that this could bring? What are your thoughts, speculations?
Oh gosh. Well, I think so. Thinking about it with a researcher hat, I think it will draw attention to links between social support and mental health. I think it will certainly do that. I think it will also highlight even further relationships, the strong relationships that exist between movement and mental health. I think we're likely to see that reinforced through this. But, I mean, there's tragic things happening at the moment with this whole scenario, so it's inherently bad in a sense, isn't it? There's some awful things occurring. But I think, humans are resourceful and resilient, and I think we'll climb our way through this, and people will learn, I think, a little bit about the importance of bonds, of friendships, relationships. Perhaps we'll think more about how important our work is, even if we sometimes don't enjoy it. Things like that. So, sometimes I think we don't like the routines we have, but they serve an important purpose in making us feel good. So I think there are some positive things that will come of it. Yes.
It's an interesting kind of thinking it, that what would it be? I think one way of thinking could be that because many things are taken away, so we might learn that what's important in life for us, or our happiness, that we kind of, because it's taken away, we will notice that it is actually important, the workplace or the relatives or whatever it is.
Exactly. Yeah, some things that we take for granted, we might appreciate a bit more. Yeah, I agree.
Yeah. And what would you be your concluding remarks related to this situation?
Yeah, so I think the message I'd like to give to people is stay connected to your family, to your close friends. Follow the guidelines that are issued by the health authorities. I think that's very important. I mean, it's clear there's a group of people out there who are not doing that. So that's obviously necessary. And try to think laterally, come up with new ways to continue your exercise routines, and try not to fall into the easy habit or pattern of becoming highly sedentary during this time if you're at home. Develop a structure and try to stick to it. Try to become disciplined in that sense. I think, there's a lot to be said for just being disciplined at times like this.
Yeah. And you said that some people are not obeying the rules or regulations. I think it's quite difficult situation, because for many young people, it's the risk is quite low, that even if you get it doesn't make a big difference, and you just one person. Some people might feel that you are not making a big difference, but it's about volumes. How do you think the message should be formalized, that people kind of that everybody is taking responsibility to stop this or slow down the pandemic?
I think if that if that message comes from multiple domains, if it comes from public health agencies, from politicians, and from parents towards children, I think if we get the same message repeated from different authorities or different figures, then that's more likely to be successful. What form it should take, I don't know exactly, but there's a lot of messages on the television, in the media, from the World Health Organization, etc., that are giving the message about the importance to sort of think globally but act locally, if you know what I mean. So thinking about it's a bit analogous in a way to the issues with the environment. You can think that, it doesn't matter if I don't recycle, I'm just one person, who cares? But it's individual behaviour that makes up the total behaviour, isn't it? So everyone counts, everyone matters.
Yeah, I think that's a very good message in the end. Think globally, act locally. So thanks a lot for taking the time to be a guest in this podcast. It was very interesting and important discussions.
Thanks, Ollie. I agree. It's a pleasure.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher podcast.